We're an immunology service, and so we look after different diseases that affect the immune system, and one of those things is HIV infection. We've been involved in HIV care right since the beginning of the epidemic in the late 80s.
The Jabs Clinic came about when a new type of medication came available for patients living with HIV. HIV therapy has always relied on daily antiretroviral medication, which for some patients can be very difficult to take. This is the first time we have a therapy that we can give as an injection, so it's 6 times a year instead of 365 days a year. For many patients, is absolutely life-changing.
I think if you work for East Metro Service, part of our job is ensuring that there's equity of care for all people, and we know that there are medical determinants of ill health, but also very strong social determinants of ill health. There's really no face of HIV anymore, and there's no particular group that's immune from acquiring HIV. So we have a very diverse clinic. In fact, worldwide, women slightly outnumber men in terms of being affected by HIV infection. And it does disproportionately affect people who are vulnerable in various ways. We saw that injectable therapy was something that could really help that particular group of people. And that's really where the motivation for us came about, to try and get access to this treatment as early as possible. It's really what's led us to become the site across Australia with the highest use of this treatment, and enabled us to become leaders in the field and educate other services about the use of this treatment. What we perhaps didn't anticipate is, for the wider group of patients that we see, this treatment has led to a really big improvement in quality of life for many people, even people without those kinds of severe social challenges.
We have now around 1,700 patients that are living with HIV that come to the clinic at Royal Perth, and these are patients that some have only joined us within the last few weeks, but some we've been looking after since the 80s. Looking after patients living with HIV, they could have to take 20, 30, even more tablets a day. Now we've just got down to 1 tablet once a day, which in itself sounds like it's not too difficult, but the burden of medication is more to do with the stigma of HIV rather than the number of tablets themselves. Even when they haven't disclosed their status to anybody, it does get in the way of their relationships. They describe living with HIV as sitting on a big secret. So by stopping having to take those medications every day, people have described how they don't think about it anymore.
It means the freedom to be able to, go down to Margaret River on a whim and not have to think about, have I packed all my pills?
I've got a patient who's a humanitarian entrant from Burundi. He's had obviously a very, very traumatic personal story of coming to this country, and has been unable to travel back to her, see her close family since her diagnosis, really because of the problems of the risk of disclosure, going back and taking all her tablets back and so forth. So having gone on this treatment, she's been able to visit her family now for the first time, including her own parents, for the first time in 9 years.
For me, excellence is knowing that we come to work and can give our absolute best for our patients, that they're able to access medications and they're able to access really world-class care, and that they will be listened to. They will come in and they know that we're not looking at them as a medical issue. They are being looked at as a person with quite complex needs, and that we take all of their concerns seriously, and then we go home at the end of the day knowing that we've absolutely given our best so that they get the best outcome.
Excellence really means trying to think about patient health problems and challenges in a holistic way, and thinking about all of the things that may act as barriers to delivery of care for them, and taking their own opinions into account. And I think about all the different ways, apart from just the medical therapy, but all of the different ways that we can address those barriers and make sure that every aspect of their lives are improved by the care that we can deliver.